Hello, welcome to the pharmacology of ANS part 2. So the question says, which of the following is not a metabolite of histamine? We have the following options, that is 3-methylhistamine, imidazolil acetic acid or imidazolil acetaldehyde or imidazolil propionic acid. So let's look at the solution. They say that histamine is rapidly metabolized by two major pathways. Those are N-methylation and oxidation. So methylation, it is catalyzed by the enzyme N-methyl transferase. You can see here, this is the structure of histamine. Okay. Here we have ethylamine that is attached to this ring, that is diazole. So methylation catalyzed by the enzyme N-methyl transferase, it yields an inactive metabolite that is called as 3-methylhistamine. So third position पर यहाँ पर 1, 2, 3. At the third nitrogen, we have a methyl group. This methyl group, 3-methylhistamine, it is oxidized sequentially via a monoamine oxidase and then aldehyde oxidase, as you can see here, to a metabolite which is called as N-methyl imidazole. So here they form imidazole acetic acid. Then we have histamine, it is oxidized to imidazole acetic acid. As you can see this structure, this is imidazole acetic acid by the enzyme which is diamine oxidase. Okay, so this enzyme is responsible for forming acetic acid of imidazole. A small amount of this acid intermediate is converted to the corresponding ribotite, which is an unusual metabolite. Okay, so these are the metabolic forms of histamine. So the correct option, which is not a metabolite of histamine, is 3,4-imidazolil propionic acid, that is option D, because it cannot form propionic acid because we have ethanamine over here and not a propanamine. So ethanamine will lead to the formation of acetic acid instead of propionic acid. Hence the correct option would be option D. Next question. Aspirin undergoes metabolism by hydrolysis, which is catalyzed by first esterase, diaphorase, peroxidase or acetylase. So the solution is option A, that is esterase. Aspirin, that is acetyl salicylic acid, this is the structure for aspirin. It is an analgesic antipyretic having anti-inflammatory effect, and the OTC drug and minute doses inhibit the aggregation of platelets. So aspirin, by the enzyme esterase, it will undergo non-enzymatic hydrolysis to form salicylic acid. So remember, because we have acetyl salicylic acid as the structure for aspirin, there won't be any other enzyme acting because we know this is an ester. Okay, so salicylic acid is formed, which will further form gentisic acid, salicylic acid and other intermediates or metabolites. So remember, esterase is the enzyme that is metabolizing aspirin. Next question, carbachol is more stable than acetylcholine to hydrolysis. That is, they are asking कि कार्बाकोल जो है वो एसिटाइलकोलिन एस्टरेज से जल्दी हाइड्रोलाइज नहीं होगा जितना जल्दी एसिटाइलकोलिन हाइड्रोलाइज होगा. So what is the reason for its stability towards the hydrolysis? So the following statement is not true. That is in चारों में से which is the false statement. The first option is the blue colored methyl group of acetylcholine is susceptible to oxidation by cytochrome P450 enzymes. Next option, the blue colored nitrogen of carbachol stabilizes the neighboring carbonyl group. Next option, carbachol contains a urethane group while acetylcholine contains an ester group. Or the fourth option, the blue colored nitrogen of carbachol is bioisosteer for the blue colored methyl group of acetylcholine. So I hope you all have understood what the four options mean. Let's look at its solution. So here we have acetylcholine. It is metabolized by the esterases which hydrolyze the ester group. Okay, because acetylcholine has an ester group. It is not metabolized by cytochrome P450 enzymes. Replacing the acyl methyl group of acetylcholine with an amino group alters the ester functional group to a urethane functional group. Okay, so this carbachol has this urethane functional group, and urethanes are more resistant to hydrolysis. That is, they are stable towards hydrolysis. अपना hydrolysis वो जल्दी होने नहीं देंगे because the nitrogen's lone pair, it interacts with the neighboring carbonyl group and it makes it less reactive to nucleophiles such as the water. Hence उसका hydrolysis जल्दी नहीं होगा. So that is the reason that carbachol is more stable towards hydrolysis as compared to the acetylcholine. Next question. Atracurium is used intravenously as a neuromuscular blocker. The molecule undergoes a chemical degradation of a slightly alkaline pH. What is the name of reaction? So जब atracurium acts on our neuromuscular ganglions, what is the reaction called as? Hoffman elimination, or McLafferty or Cope rearrangement? So the solution for atracurium action is Hoffman elimination. So this is the structure of atracurium. As you can see, Hoffman elimination will cleave the chain linking both halves of the molecule, and it is driven by neutralization of the positive charge on one of the nitrogen atoms. As you can see, we have a positive charge over here, that is quaternary monoacrylate, and we have laudanosine over here. We have two structures that are formed as the structure of atracurium is cleaved from this part. So once the molecule has been split into two parts, the required pharmacophore, which is important for the activity, you can see it involves both charged nitrogen atoms. Okay, and hence we form diacrylic acid ester and laudanosine over here. So this reaction is Hoffman elimination. Next question. Several aromatic amino acid residues present in the cholinergic binding sites are thought to interact with acetylcholine by means of induced dipole-dipole interaction. So they are asking which part of acetylcholine is involved. The acyl methyl group, the ester, ethylene bridge, or the quaternary ammonia head. So this is the structure of acetylcholine. It has acyl methyl group, ester over here, quaternary nitrogen, and the N-methyl groups are these. So the quaternary ammonium group, it could be sandwiched between the heteroaromatic and aromatic rings of amino acids such as tryptophan, tyrosine, resulting in induced dipoles in the heteroaromatic or aromatic rings. Hence the correct option here for interaction which is shown by means of induced dipole-dipole, it is the quaternary ammonia head which is responsible. So the correct option is D. Next question. The 2-bromopyridine and chlorophenyl acetonitrile are the starting material for which of the following? That is phenyramine, imipramine, cetirizine or triphenamine. So the solution for the given question, that is 2-bromopyridine and 2,4-chloroacetonyl acetonitrile, is they will lead to the formation of chlorphenyramine. Hence the correct option is A, that is phenyramine. Next question. Which of the following statement is false when comparing 3D QSAR with the conventional QSAR? QSAR is qualitative structural activity relationships. So let's see which is the false statement given here. So option A is only drugs of the same structural class should be studied by the 3D QSAR or QSAR. Then we have 3D QSAR has a predictive quality unlike QSAR. Then experimental parameters are not required by 3D QSAR but they are required for QSAR, and the results can be shown graphically in 3D QSAR but not with QSAR. So they have asked the false statement. The correct option is option A, that it is possible to study the drugs belonging to different structural classes as long as they share the same pharmacophore and have the same binding mode. Okay. So that is the minimum requirement. They should have same pharmacophore and same binding mode, and those drugs can be studied by 3D QSAR or QSAR. Next question. What software program is used to determine the Verloop steric parameter? The options include Alchemy, Chem3D, Sterimol or ChemDraw. So the correct option here is Sterimol, because ChemDraw, that is a chemical structure drawing package. Here we can draw a number of structures. Then Alchemy and Chem3D, these are the molecular modeling softwares. And they have asked to determine the Verloop steric parameter. For that we have Sterimol. Next question. Which of the following ring is present in meperamine? The options are piperidine, pyrimidine, pyridine or pyridazine. So the solution is option C, that is pyridine. So here you can see this is the pyridine ring that we have. So this is the ring which is present in meperamine. The IUPAC of meperamine is given here. You can see N-pyridine. Next question. Dipyridamole is a derivative of quinoline, phenothiazine, pyrimidopyrimidine or piperazine. So let's focus on the name of the drug, that is dipyridamole, and the options here. So the solution is, it consists of two pyrimidine ring fused together and it is called as pyrimidopyrimidine. Hence the correct answer is option C, that is pyrimidopyrimidine. Okay. This is the structure of dipyridamole. Next question. All of the following exhibit conformational isomerism except. So the options here are histamine, acetylcholine, muscarine or 5-hydroxytryptamine. So here is the solution for which of the following exhibit conformational isomerism. We need to remember that in aqueous solution, histamine exists in two tautomeric forms because it has an imidazole ring in its structure. You can see two nitrogens in a 5-membered ring. The imidazole ring has two nitrogen and the position of nitrogen with hydrogen on it determines how the tautomer is named. So in first structure we have NH over here, but in the second one, after tautomerism, the double bond shifts from this nitrogen to this one and hydrogen shifts from here to here. Hence it does exhibit structural isomerism. Then we have acetylcholine, which shows conformational isomerism and it forms anti-periplanar, synclinal and syn-periplanar anticlinal isomers. Then serotonin, that is 5-hydroxytryptamine, it also exhibits conformational isomerism. They have asked which does not exhibit the isomerism. So the option is option C, that is muscarine. So muscarine, it mimics the function of natural neurotransmitter, that is acetylcholine. Okay, here you can see we have 3 methyl groups attached to a nitrogen, making it a quaternary structure. Then muscarine mimics the function of natural neurotransmitter in the muscarine part of the cholinergic nervous system, and despite the less flexible structure due to the 5-membered ring in the molecular skeleton, okay, it has this 5-membered ring, it has no conformational isomers. So option C, muscarine, does not possess any conformational isomerism. Next question. Probenecid is a benzoic acid derivative and its actions are. So P is to prolong the beta-lactam antibiotic action. Next, to alleviate gout, to prolong local anesthetic action, or to increase the L-DOPA action, that is levodopa. So which of the combination of the statements is true regarding probenecid? So we know that probenecid, it prolongs the beta-lactam antibiotics such as penicillin, and it is also used in the treatment of gout. Okay. Also probenecid, this is the structure, it is a uricose uric drug. It prevents the reabsorption of uric acid. अगर उसका reabsorption वो prevent करेगा, it will increase its excretion. By preventing the reabsorption from the collecting tubules of kidney, उसका excretion वो बढ़ा रहा है and it decreases its plasma concentration. So the correct combination here is P and Q. So P statement says that it prolongs the beta-lactam antibiotic action. Then to alleviate gout. So it is used in the treatment of gout. Apart from the release of EDRF, that is endothelial derived relaxing factor, the other mechanism of vasodilatory action of acetylcholine is, so yes, acetylcholine does cause vasodilation. So they are asking the mechanism for the same. So here we have direct action of acetylcholine cause vascular smooth muscle relaxation. Inhibition of norepinephrine release from adrenergic nerve ending. Stimulation of platelet aggregation or the stimulation of vascular beta 2 receptors. So the correct answer here is option B, that is inhibition of norepinephrine release from adrenergic nerve ending. Now remember, norepinephrine जो है ना, it will increase the alertness, arousal and attention. After doing this, they will constrict the blood vessels, which helps to maintain the blood pressure in the time of stress. So what does acetylcholine do? It causes inhibition of norepinephrine release from the adrenergic nerve ending and it brings about the vasodilatory action. Next question. Targets of the autonomic nervous system include all of the following except. So हमारा जो ANS है, where all does it show its action? The options are exocrine glands, skeletal muscles, endocrine glands or smooth muscles. For this, you need to remember this flow chart, that the nervous system contains central nervous system, which will be acting upon the brain and spinal cord, and the peripheral nervous system. It has two parts, that is somatics and autonomic. So for the skeletal muscle, the somatic nervous system is responsible. Okay, hence skeletal muscles are under the control of somatic nervous system. And what they have asked, for autonomic nervous system, the targets are, so they will show their effect on the exocrine glands, endocrine glands and the smooth muscles. Next question. All are classified as the reversible anticholinesterase except. Options include pyridostigmine, amvinonium, physostigmine or ecothiophate. So they need to know which is an irreversible anticholinesterase. So we have only organophosphate with the quaternary structure that are classified as the irreversible anticholinesterase drugs. Okay. The examples are here for organophosphorus compounds, and carbamates are also there, for example carbaryl and propoxyl. These are the irreversible anticholinesterases. So remember this flow chart for the cholinergic agonist. Next question. A patient complains of muscle weakness. It was reversed on administration of neostigmine because. So here you need to know what is the mechanism of action for neostigmine. So does it block the action of acetylcholine? It interferes with the action of amine oxidase, interferes with the action of carbonic anhydrase, or does it interfere with the action of acetylcholine esterase? So for the mechanism of action of neostigmine, we should know that it is a reversible acetylcholine esterase. Okay, as it is inhibiting the acetylcholine esterase, what will it do? वो उसके breakdown को कम करेगा, acetylcholine के breakdown को कम करेगा, so amount of acetylcholine will increase. So as acetylcholine, more amount of it is available to attach to the muscle receptors. It improves the muscle strength. Okay, so the correct option here is option D, that is it interferes with the action of acetylcholine esterase. Next question, belladonna poisoning is best treated with. The options include neostigmine, physostigmine, acetylcholine or adrenaline. So belladonna poisoning, in this condition, physostigmine of 0.5 to 2 milligram IV dose is given as required. It is the specific antidote for poisoning with belladonna or other anticholinergics. Hence the correct option is B, that is physostigmine, and it penetrates the blood-brain barrier and antagonizes both central as well as peripheral actions. Hence belladonna poisoning के वक्त we need to give physostigmine. Next question, the neurotransmitters released by the parasympathetic preganglionic and postganglionic nerve fibers are. So they need to know कि preganglionic and postganglionic nerve fibers से which of the neurotransmitter is released. Is it acetylcholine and epinephrine or norepinephrine and epinephrine? Only acetylcholine or acetylcholine and norepinephrine. So let's look at the solution. So this is a very important chart, or you can say the diagram for the release of neurotransmitters. The transmitter is released and from the preganglionic and postganglionic. So here you can see somatic nervous system mein, as they are acting on the skeletal muscles, nicotinic receptors per we have acetylcholine release. Then autonomic nervous system mein, at the parasympathetic level, the nicotinic receptors have acetylcholine, but the muscarinic ones have acetylcholine too. Okay. Then the adrenergic ones, preganglionic mein they have acetylcholine, but at the postganglionic, when there are alpha beta receptors, they will have noradrenaline. In case of muscarinic receptors, they have acetylcholine, and in case of adrenal medulla, there would be adrenaline release in the bloodstream. So the correct option here is option C, that is at both the fibers acetylcholine is released. In carbamate poisoning, all of the following should be administered except. So which one should not be administered during carbamate poisoning? Is it atropine, oximes, the gastrin levels, or the none of the above? So the correct option is oximes, that is option B. Oximes should not be administered during the carbamate poisoning because it is contraindicated. Not only does it not reactivate carbamylated enzyme, it has weak anticholinesterase activity of its own too. So oximes, for example pralidoxim that we know that it will reactivate our acetylcholine esterase, but it also have anticholinesterase activity too. Hence it should not be administered. Next question. In male sex organ, dash system is responsible for excretion. So for this you need to know कि कौन से receptors are present at the male excretory organs. Is it sympathetic, parasympathetic, norepinephrine, or none of the above? So the correct option here is parasympathetic. The activity of postganglionic neurons in the parasympathetic ganglia, which is present. It causes dilation of the penile or clitoral arteries. Okay, so parasympathetic receptors are present and those are responsible for the dilation of penis and clitoris. Also, relaxation of the smooth muscles of the venous sinusoids. It takes place by the cholinergics, which leads to expansion of the sinusoidal spaces and thereby control excretion. So, we know cholinergics, that is parasympathetic, is responsible for the excretion. Next question, the statement regarding use of adrenaline in anaphylactic shock. So which one is the true statement to be given for case of anaphylactic shock? Is it 0.5 milligram of dose by intramuscular route, or 1:10,000 concentration of adrenaline, or is it repeated after every 4 to 6 hours, or same concentration can be given for subcutaneous as well as intravenous route? So remember, the correct option here is option A, that is 0.5 milligrams of dose is administered by the intramuscular route. So in case of anaphylactic shock or angioedema of larynx, okay, these following measures are to be followed. We have to put the patient in the reclining position, administer them oxygen at high flow rate, and then we need to perform the CPR, that is cardiopulmonary resuscitation. Then after putting the patient in the reclining position and CPR, we need to inject them adrenaline, that is 0.5 milligrams. So here are the given doses for adrenaline, and it is to be given by intramuscular route, and this process is to be repeated 5 to 10 minutes in case the patient does not improve. So yes, the option is A, 0.5 milligram of adrenaline dose is to be administered by intramuscular route. Next question, all of the following agents are used in obesity except sibutramine, olestra or neuropeptide. So let's look at the drugs one by one. We have orlistat, which is an inhibitor of gastric and pancreatic lipase. It interferes with digestion and absorption of the dietary triglycerides. Then absorption of cholesterol and fat soluble vitamins is also impaired in the using of orlistat, and it has facilitated the weight loss in clinical trials. Next agent that we have is sibutramine. Noradrenergic or serotonergic agent, that is sibutramine, it activates the hypothalamic adrenergic or dopaminergic receptors, have residual stimulatory effects and interferes with the sleep and primarily affects the appetite center. Olestra that we have is a sucrose polyester which can be used as a cooking medium in place of fat, but it is neither digested nor absorbed, and its acceptability is also inconsistent. Hence the correct option here is neuropeptide. It is not used in the obesity drugs. Next question, the drug fenfluramine is used to treat. Is it gout, radiation sickness, Dressler syndrome or obesity? So we have fenfluramine and dexfenfluramine. They will reduce the food seeking behavior by enhancing the serotonergic transmission in the hypothalamus. What are they doing? They are reducing the food seeking behavior. They were extensively used by the slimming centers though tolerance to the anorectic action develops in 2 to 3 months. Okay. Hence, as you can see, they are decreasing our will to eat. Hence, they are used in the obesity treatment. Hence, the correct option is D. And fenfluramine selectively releases 5-hydroxytryptamine by promoting its reverse transport at serotonergic nerve endings in the brain. So, it has anorectic property. Next question. Which of the following agents has been associated with hemorrhagic stroke? Is it phenylpropanolamine, terfenadine, quinidine or fenfluramine? So the correct option here is phenylpropanolamine, and they will say that they are used with hemorrhagic stroke and concerns regarding its potential. What will they do? Precipitate behavioral psychiatric disturbances, and they have prohibited the sale of phenylpropanolamine. So yes, this is the adverse effect relating to phenylpropanolamine, that is, it causes hemorrhagic stroke. Next question. Assume that the diagram below represents a sympathetic postganglionic nerve ending. Okay, so see this sympathetic postganglionic nerve ending. When they talk about sympathetic, adrenergic neuron they are talking about. So which of the following blocks the carrier represented by Z in the diagram? So they are asking यहाँ पर कौन act कर रहा होगा? So as you can see, X, Y, Z. So they are asking this Z. It is very evident that something that is released from the nerve ending Z is not letting it reuptake. So is it cocaine, amphetamine, hemicolinium or all of the above? Let's look at the solution. So sympathetic postganglionic nerve ending. So noradrenaline is released mainly from the nerve endings. And as Z represents inhibition of the reuptake. Okay. Something is not able to reuptake from here. So cocaine inhibits the reuptake of the dopamine and serotonin as well as norepinephrine. So cocaine is the drug जो क्या करेगा, after norepinephrine or dopamine or serotonin is released from the nerve ending, high affinity के साथ वो bind कर लेगा with the serotonin transporter, dopamine transporter or norepinephrine transporter. Hence, cocaine is the answer that is preventing the reuptake from this point. Thank you so much.